Welcome to the Prime Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to Prime Health in life and in business. Now, I'd like to ask you a question. What happens when someone experiences the healthcare system not just as a provider, but as a patient who couldn't get answers? Now, today's guest, Dr. Jade Fricks, owner of Fricks Pharmacy, an independent pharmacy, and Total Wellness, where she practices functional medicine, has lived both sides of that. And what she discovered might change how you think about care entirely. So yes, just like you, I'm excited to hear what she has to say. But before we jump into the episode, just a quick message from our sponsor, Growth Solutions, where we believe every healthcare provider and professional deserves exceptional growth partners to match their ambition and reach their potential. Now, Growth Solutions is not an agency or vendor. We are your growth partner, and we take a diagnostic approach to your business. We analyze where time, money, leads, or opportunities might be leaking from the business. We help eliminate stressors in the business, such as new patient or client acquisitions, marketing and growth strategies, reducing operational chaos with proven systems, frameworks, and SOPs. And yes, understanding AI and those crazy bots, because they're coming for us, whether we like it or not. So if you've ever thought this to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your solution. If you'd like to ask me a question, reach out to any of the social channels and I'll get back to you as soon as I can. But you are here for a reason. That's to hear from our amazing guest. Now, Dr. Jade, welcome to the Prime Health Podcast. And please tell us a little bit about yourself and what you do.
Well, thank you so much for having me. I'm excited to have this discussion with you. So I am a doctor of pharmacy who went rogue on the system, and I practice functional medicine now. I, as you said, own an independent pharmacy and had my own health crisis back in 2019, and I just really got thrown into the patient seat, whether I liked it or not. And I was really disappointed with the outcomes of, just going from specialist to specialist, searching for answers. And it was really eye-opening from a standpoint that, here I am with a doctorate, and I had to advocate for myself pretty aggressively. And so when you look at that from a patient perspective, who doesn't have any type of formal training in our medical system, it was really disheartening. And then also owning an independent pharmacy, seeing that play out at scale and seeing those similar patterns happen to my patients, it was really eye-opening. And so, I went from specialist to specialist, and I essentially was sick and tired of being sick and tired. And functional medicine kept coming up in different conversations, or, at conferences, I would hear this buzzword. So I looked into it. I enrolled myself in school and was like, if no one can figure out what's wrong with me, then I'm going to do this myself. And, you and I have talked in length prior, but I had a pretty wild healing journey. I used multiple modalities. I used functional medicine, acupuncture, EMDR training for trauma work. So it was a very eye-opening experience, and it was also very humbling, because when I got out of pharmacy school, I had the Western medicine ego. Drugs were the only cure. Supplements are hoaxy, and the hoaxy stuff is the very thing that healed me and helped me reverse my autoimmune disorder. So that was a very humbling experience. But yeah, that's how I got here.
Well, unfortunately, sometimes when we do go through those trials and tribulations, it makes it better, not only for us, but the patients, the clients that we see in the long run. So again, unfortunately, I'm glad you had to go through it. It's beneficial for other people, but hopefully the EMDR helped you get past that as well. I'd like to jump back and, what was the reason, or was there a moment in life that said, I want to become a pharmacist?
So I actually grew up around pharmacy. It's all I knew as a child. My great-grandfather opened the first pharmacy in my hometown in Kentucky, and then my grandfather took over that, and then my dad took over the business, and then I went to pharmacy school, and I just always knew I wanted to own an independent pharmacy. It's just what I was around. I loved seeing how, my dad helped people in the community. We would be at church and people would be like, oh, my kid's sick. Can you go up in the pharmacy? And it was just a really rewarding career. So I always knew that I wanted to go into pharmacy. But what's interesting about it is I was really interested in, health and wellness type things, but I definitely still, like, going through pharmacy school, came out with that ego that, supplements didn't work. But that's how I landed in the pharmacy world. It's just what I grew up around. It's what I knew.
Yeah. Reading on your website, it says that you're a next generation pharmacy. I'd like to know what that means to you.
So, I'm a little bit of I like to trailblaze things. So, my husband, he's also a pharmacist. We met in pharmacy school. And so we always knew that we wanted, a traditional type pharmacy, but we didn't want the mom and pop pharmacy that had the soda shop and, all the things. It's kind of odd if you're dispensing diabetic drugs, but then you're also dispensing milkshakes to make the diabetes work, So we both always knew that we wanted our pharmacy to be more of a trailblazer pharmacy of doing, like, whatever. We both always want to practice at the top of our license. So we always knew that we wanted to put, like, a health and wellness spin on that. And then going through my own health journey and my health crisis, it really just opened it up to, like, oh, like, this is an opportunity. And this is actually, from an entrepreneur standpoint, like, this is a big gap in the market. Like, I wanted to create what did not exist for me. I had to fly to Massachusetts to find a functional medicine medical doctor that, had the training that I wanted, who could speak both languages, which was Western medicine and functional medicine. So I wanted to create a wellness clinic that just didn't exist when I got sick.
Would you say of how many classmates that you graduate with as a pharmacist are running their own, like, pharmacy themselves independently and or have ventured off into functional medicine?
I do have some classmates. There was a subset of students in my in my graduating class that knew they wanted to be independent pharmacy owners. I don't know of any in my class, though, that are doing, like, adding on the functional medicine concept to it. Now that I've got into this space, I actually have a lot of pharmacists reach out to me and ask me, how did you do this? Like, how did you create the business? Like, what does it look like? So yeah, I actually have people reach out to me now. So I think that more and more pharmacists are interested in functional medicine. I personally think that pharmacists are set up really well to practice functional medicine, because I've yet to have a client come to me who wasn't on medications. And as a pharmacist, I'm the medication expert. And so when we make these, lifestyle changes and we start uncovering root causes and things start improving, they usually need help with tapering down on certain doses. And so I can help them safely do that. I can work with their provider. So it's really nice that I can speak both languages, because I've yet to have a client or a patient come to me that, hasn't exhausted the Western medicine things that it has to offer. So that's a nice part of it.
Yeah, that's a great perk. I really didn't think of that, of knowing how when most people are experiencing issues, they typically are on a medication. Hint, hint, sometimes that medication does give them some of those issues secondarily of trying to help them in one regards. But what a great supplement, literally, that you can offer to the patients that come in.
Yeah.
So I do want to talk about total wellness, the functional medicine side of your practice. So for the people that may be listening that haven't heard of functional medicine, how would you explain the difference between managing symptoms and actually addressing the root cause?
So that's actually my bread and butter.
Okay.
I actually had a call with someone this morning, and they were like, so do you treat this? And I'm like, I don't treat anything. I want to know what your diagnosis is, but your diagnosis doesn't tell me anything in regards to what the root cause is. Like, what is causing this? Like, and I work with a lot of autoimmune patients. I work with a ton of patients with Hashimoto's. Like, that's kind of my bread and butter is thyroid, autoimmune thyroiditis, and gut work. But patients come to you with these autoimmune diseases, and for example, with Hashimoto's, you see an endocrinologist for that. So you have a specialist that, focuses on your thyroid, but the issue is not your thyroid. The issue is you have a hyperactive immune system. So from the functional medicine lens, I'm not asking what your diagnosis is. I'm asking, why is your immune system that should otherwise be calm and tolerating your environment, why is it hyperreactive? Why is it attacking your thyroid gland? So I essentially take what someone has and I ask why they have it, why their unique physiology is responding in this way. And I look for those root drivers.
Okay. So when from a functional medicine standpoint, the patients come into you, there are expectations that they probably have. And what most of them think, well, I've got to take a handful of pills and I've got to do a bunch of blood testing. That's unfortunately the negative that may be out there. So what actually drives results for your patients versus a handful of pills and starting with a big blood test? Not that you don't do that.
Yeah, so I use the lab testing. That's another thing that I love about like having the Western medicine background. I can layer in the Western medicine conventional labs with the functional medicine labs, and you really can see two different worlds and kind of overlap those and look for trends. But when I have patients that come in, so I actually built out a program. I no longer do one-off consults. That's something that I realized early on. When I first opened Total Wellness back in 2023, I just did the one-off consults. I really didn't screen for who I was working with or anything like that. I just let whoever schedule an appointment essentially. And what I found with that is that it resulted in a misalignment with what my goal is in functional medicine and what certain people or patients' goals were as well. And what I found is that, me being a pharmacist and then people knowing that I'm in the health and wellness space, they're like, "Ooh, she's a supplement guru."
Yeah.
And I am very comfortable with supplements just because of my background, but that's not what functional medicine is, because some people will come in and they're essentially looking for a supplement to treat XYZ instead of a drug, and then we call that holistic, and it's not. So functional medicine is, again, looking for those root drivers. And yes, I do use supplements. Yes, I use testing. Because again, I don't believe in guessing. I do think if we have, there's so much available now, like the biohacking industry has gone wild. So we have tons of opportunities to track health metrics. But the challenge with just testing is patients will, and now that I have my program built out, patients will come to me and they've already worked with other providers and they have a ton of labs, they have a ton of information, but they don't know what to do with it. And, we can have all of these esoteric, expensive labs, but if we don't have actionable steps to actually move the needle in their health, we're not really getting anywhere. So that's what I love about my program is I help people with, condensing down into bite-sized pieces on how to take actionable steps with what we found in the labs or what we found as root drivers. And then I essentially support them through the program. Because anytime and I'm sure you know this too, but anytime someone's trying to implement changes in their life or diet, lifestyle, things like that, or just implementing a protocol, it can feel overwhelming. And so that's a big part of what I do is supporting people as those barriers come up.
Yeah, because, and I don't practice functional medicine, but if somebody does, they come in like, I'm a type 2 diabetic. Can you fix me tomorrow? How do you go about that expectation component that they do? I know thyroid is your gig, but when somebody comes and says, I want to be fixed tomorrow, how do you approach that with them? And I guess that comes to building trust with them too.
So if a patient, came in and they're like, I have type 2 diabetes and I want to be fixed tomorrow. So that patient would actually not align with my program because we're essentially, now that I've niched in on who my ideal client is versus when I first started out, I had not really niched in. I worked with anybody that would book a consult essentially. And I realized that I needed to do a better job of screening potential patients to make sure that we were both aligned to work together in my program. And that's when I started building out the program. So now I have my ideal client. I know her age, I know her interests, I know her career type. I'm very specific on who my ideal client is now. And when I did that, it made it really easy to build my program out because I was building it out around her. So when you say if someone comes in and, they have type 2 diabetes and they want to be fixed tomorrow. So that's why I offer a discovery call. We essentially are screening someone to set those expectations that this program is not a quick fix, that the reason it's 6 months is it takes time to essentially peel back the layers of the onion to piece the puzzle together of you and then address those root causes.
Yeah. I want to dive a little bit into your situation that took place for you to make the change from being the pharmacist and then learning about functional medicine. So whether there's a clinician out there like you were, other healthcare providers that fit their model, doctor, nurse, whatever it may be, they may feel stuck in the system like you felt. What would you say to somebody of why there is a better way and why functional medicine is potentially that approach that they should look at?
Like their approach in regards to their own health, or
Fixing themselves. Like because when you left pharmacy, you had a certain thought process about it, that what other people were doing functional wise wasn't correct. That's changing in a broad perspective. But now I'm a chiropractor, I'm a pharmacist, I'm an orthopedic surgeon, I'm having health concerns with myself. What would you suggest I consider as like a best next step to take to try and get better resolution for my health problem?
So, it's funny because when I went through my health crisis and then I went through my functional medicine training and got certified, I actually tried to continue practicing pharmacy. I tried, but the curtain had been lifted. I could no longer practice pharmacy in the way that I had, because these people would be coming to me with issues where, they're being given an as needed med to cover a symptom. And I'm like, these are basic things that we could cover with diet and lifestyle, or it could potentially be a nutrient deficiency that we could run a red blood cell magnesium and see like it address that with a supplement. So I literally could not go back into practicing in the same way. But yeah, a first step, like if you're having your own, if someone were to be thrown into my situation where you're, having a health crisis and you're being tossed around in the system and you were trained by the beast yourself, so that you're getting tossed around, is start looking into other things. For me, it was functional medicine. I love functional medicine because, again, it's looking for why. It's looking for the why. It's looking for the root driver. It's not looking for a drug to put a Band-Aid on a symptom. It's because a symptom is your body saying, hey, something's off. Like, I need you to pay attention to this. It's not meant if we have a headache to go and pop an ibuprofen. Like, that headache is actually using precious energy and nutrients from your body to even create the headache, to tell you, hey, something's off. We need to address this. So that would be my recommendation, is to start looking into, to get out of that Western medicine tunnel vision that this is the only way, and start looking at other things. And, there's tons of podcasts now. Dr. Mark Hyman has his podcast. There's so many things available where you can look online and just start consuming the information and see, is that an approach that you would be interested in learning more about?
Yeah, because I'm sure there's a lot more out there than when you first started going through your change. You had to search hard, and like you said, you had to go from down south, the Northeast, to try and find a provider, which is unfortunate back then. But people are in a better condition at this point in time to find that. So I'd love. You said what your niche is. Could you tell the viewers and listeners who is their ideal niche, that they may be somebody that wants to give you a call for care?
So yeah, my primary focus is with thyroid disease, autoimmune thyroid conditions, and then obviously gut work, because if there's autoimmune present, we're going to be doing a lot of work on your gut. So that's my niche area. That's the area that I primarily work with. That's what I see a lot of patients with, is Hashimoto's thyroiditis, thyroid disease, and gut issues.
Okay. And men and women, or is it strictly women that's your niche?
Well, that's a funny question. So I primarily work with women, but they'll usually go through my program and they're like, will you see my husband? Understood. Yeah. So for an ability to brag about yourself, Dr. Jade, I'd love for you to say, so let's just say I'm a functional medicine provider. I work with, women, Hashimoto's, thyroid. What do you do? What's your differentiator that makes you better than me or the other professionals that are out? I don't, it's one of those things, like being in business, like I've never been one to be like, you're my competitor. Like
Okay.
even in the pharmacy world, I was never like that. I was like, how can we lock arms and work together for the better good of the patient? Because I know that, say you are the male version of me and you have a practice down the street from me. I don't necessarily view you as my competitor because you're not me. I have a very different lived experience that I bring my own unique quirks to the table that attracts a certain type of patient. So I very much believe there's enough to go around, and it's when you get into like the copying and things like that. I think it really just hurts the patient. I think you just need to be an authentic practitioner and stay true to who you are and what you're good at.
Yeah, I agree with that so much about authenticity. Because the truth is, if you're authentic, you're going to sit there with the desire to listen better and to care more. Not that somebody that isn't authentic doesn't do that, but your bottom line is the betterment of the patient. And when you're being your authentic self, you don't have to hide anything, and you're not worried about what the person, male or female, down the street is doing that might be better than you, because they could have a process that they do that's completely different than yours.
Yep.
And maybe for some of the population, they get them better, they can find a solution, but it's still two people going, one sees me, one sees you, and then they switch roles and they see you and then they see me. They're like, I like Dr. Jade better than I like Dr. Derek. It's understandable. We just have to go with those that come in for us. So I can appreciate that.
Yeah. And I think that your authenticity, I mean, this is not something that I just woke up with one day. I definitely had to work on that mentality. But as far as being authentic, and I think being authentic, it's a really cool thing if you, it feels vulnerable at first, but if you stay true to being authentic to who you are as a practitioner and in your space, whatever your expertise is, what you will find is that if you stick to your why and your authenticity, what you will find is that that authenticity will attract the right patients and it will repel the patients that you don't need to work with, because we've all worked with patients that drained our energy, caused a lot of frustration, and it really was because it was a misalignment. So that's another thing that I found is like staying true to just like who I am authentically as a practitioner.
Yeah. And that authenticity, you just like you work with gut health, you've got to go with your gut feeling as well. When you go to, it looks like it could be a perfect fit, but when the discovery call goes through and it just doesn't feel right, and you have to trust in that. Yeah. I'd love for you to share, Dr. Jade, maybe a success story of somebody that's come through one of your programs and where they started and how they finished.
So that's the cool thing about functional medicine. You have different scenarios, but I have one patient that, she's just so dear to my heart. She still keeps in touch with me like 2 years later. But she came to me, she was postmenopausal, had been diagnosed with osteoporosis, and just, she had over 20 years of headaches and had been through all the triptan drugs that are used to treat migraines. Her doctor at that point was recommending her to start one of the newer injectable migraine drugs, which she was kind of skittish about needles. So she had retired 2 years prior. So she was like, I'm going to put my health first. Like, I want to try this. I'm going to put my health first. And it was just such an awesome experience because she is now, 2 years after working with me, she still is migraine free. And it was such a rewarding thing because, as you work with these people in a program setting, you really get to know them. You get to know a lot about their lives, and they also share a lot of really vulnerable, hard things with you. And her migraines had affected her ability to work later on in her career. I mean, it really had impacted her quality of life. So it was really cool to see her, because 2 months into the program, she was like, I haven't taken any of my meds. Like I don't need them. Yeah. And it was just so awesome. And what was so cool was that she couldn't believe that it was the basic foundational things that we had addressed that had essentially her migraines had resolved. And she couldn't believe that it was something that simple, because when you're dealing with something like that and it affects your quality of life for that many years, you really succumb to it. Like she had essentially, I guess the way I would put it, she had essentially just accepted that as her reality. And that's just how she was living her life. So it was really cool to watch her like want to take on new things. Like I said, she had retired, but it was just this new it was just this new something within her that she was like, I think I want to take on more. So anyway, that was a really rewarding case because of her age and the number of years that had affected her. So she's just near and dear to my heart.
It's a great story. It's a wonderful story, but there's a sad component to that, meaning there are so many people that don't know or aren't willing to take the risk or the chance. It's not a big risk to set up a discovery call with you and learn a little bit more about how you could help them. They can always say, I don't want to continue care, but you've got to take that chance, that opportunity, because there's just too many people outside these four walls that are suffering and are just continuing to pop another pill, do another injection. It's the saddest part, that medicine still has such a stronghold, and partly because of all the commercials that are on TV that show you. Yeah. Dr. Lee, from a business standpoint, what's the focus on your business right now? Like, how are you growing it, or what direction are you going?
So, I have a brick and mortar, and, when thinking about, like, it's funny because when my husband and I, we've opened 2 independent pharmacies from the ground up, and there were a ton of learning curves there because, when you go to school, especially in the health and wellness space, or if you're going to school, for the medical side, whatever it is, they don't teach you financial literacy. And so when you go into the side of owning a business, you get a crash course really fast. So I learned so much from opening those 2 pharmacies that I have been very careful, and I've been very intentional with opening Total Wellness, of making sure that I have the foundational groundwork laid so that I can pivot if I need to. Because when we opened our first pharmacy our second pharmacy in 2020, that's when COVID hit. And everything I knew from our previous pharmacy went out the door because the world flipped upside down overnight. And that taught me a hard lesson, that I can have a 5-year plan, but healthcare is changing. The world changes very quickly, and you have to be able to pivot. So anyway, when I think about, like as far as growing my business and what I'm trying to do within the next 3 to 5 years, this is more from a personal standpoint, but my kids are no longer babies. I've got about 8 years left with my oldest before, he leaves the nest. And so this is a conversation that my husband and I have a lot. We've been having a lot over the last probably 2 years of, like, what does that look like? We've spent so much time growing businesses and pouring into our career. You wake up one day and your kids are no longer little, like they're growing up. Yeah. So where I'm going with that is I was very hesitant to take on virtual clients. And I started taking on virtual clients about 12 months ago because I'm very big on that human to human connection. I think that it matters. And I think sometimes you can lose that in a virtual type setting. And so that was my hesitation in trying it. But over the last 12 months, I've taken on more virtual clients, and it actually has been really rewarding. It actually, it proved me wrong on a lot of things. So I actually am looking to have more of a hybrid model. So I have my brick and mortar now, but I'm looking to have more of a hybrid model just to give me the flexibility with my kids, just with them growing up. So it's more of a personal decision on that.
Yeah, good. Well, I'm, our son is in his last month here of school, of college, if you wish, and the time went by so quickly. I just had a 13-year flashback of when he was playing lacrosse, and he'll be playing his final games next weekend. So it does go by fast. You want to do the best you can to help everybody that's out there, but you have plenty of time when your children are gone that you can work. So to me, family is very important, and I know you're faith-based as well. And I think that that's a wonderful thing, that, family comes first, business is there. You want to do what you can to help, but you want to be a great mom to your kids. Yeah. Yeah. I love it. So you've been an amazing guest. Just a few questions left here, but if people are interested in learning, if they want to become a patient of yours virtually, if they're local to your community and they want to learn more about Total Wellness as a walk-in or about Fricks Pharmacies, where would you like to send them?
So we have a website. So it's just frickspharmacy.com. And I have a presence on Instagram. So it's Total Wellness of Pensacola. And that's where you can check out more information about me.
Perfect. I'll make sure to share that with it. So the last 2 questions, kind of about health. If you could give one piece of advice that could affect our viewers or listeners in a positive way, what would that be?
So I think that an easy I'm always looking for, when I'm talking with my patients, how can I always tell my patients when I can see it in their eyes, like, okay, they're getting overwhelmed. And when I see that, I always say, how do you eat an elephant? And the reaction is, oh, I always enjoy it so much. I get a wide variety of looks when I say that.
Right.
But the point that I tell them is that you can't eat an elephant in one bite. It's small bite-sized pieces. So when I think about a health tip, and when I'm telling patients who are overwhelmed with, making dietary changes, especially if I have someone coming to me who has only ever eaten out, they've never prepared food for themselves, and then I'm telling them, eat a whole foods diet. And they're like, what's a whole food? Like, how do I cook the whole food? So I tell people a simple, basic principle to live by is to eat God's food. God's food is naturally whole. It runs, it walks, it flies, it swims, it grows from the ground. And every time I tell one of my patients that, I can just see like the weight come off of them. Because when you go to the grocery store and you look at the produce section, you can easily tell what God's food is. If there's a stalk of broccoli, you know what that is. You do not need to look at a box and read a label to know that it can be eaten, and it's food. So that's my simple health tip.
I love that. I've not heard of that, not thought of that, but as God's food, I can't wait to share that with my wife. We'll love it. Thanks, Dr. Jade. Last question. You've been an amazing guest here on the Prime Health podcast. I always ask, what is your definition of Prime Health?
So my definition of prime health, and I envision it like, you're waking up in the mornings and you jump out of bed, you have mental clarity, you have energy, you just go about your day. You're living in a body that you don't even have to think about. You're living in a body that's not limited by symptoms. And it's not as much about, not being sick or being free of disease. It's being able to have the capacity to live the life you want to live in your body and not be limited by symptoms.
Yeah. If you had a pharmacy that sold that pill, I'd buy a couple of them. That's for sure. So
yeah. I mean, if we could just create that pill, then everyone would love that.
Yes, they would. They would. So would the pharmaceutical company. They make a couple bucks off that as well. So Dr.
Yes.
Jade, thank you so very much for sharing your insights and unique perspectives. It's very, very interesting that you've come from a family of pharmacists. Unfortunately, as you said, you had to experience your life situation that caused a little bit of a change, but I do believe that that's for the better. In the long run, it wasn't enjoyable at the time, but in the long run for your clients, it works much better for them. And I always say this, when you're listening or watching this, if you've heard one thing that Dr. Jade has shared, I know there's more than one thing, but at least one thing, please share it with a friend, colleague, family member, whoever it may be, because it's that ripple effect. If we can get one person, you never know how that person's going to share it. So please do share the podcast, especially this episode with them. I always ask selfishly, please do subscribe to our podcast or share it to other people that you think this would be enlightening for them. But until next time, remember that we are all on a journey together of true wellness. And whether you're taking charge of your own health or guiding others in theirs, just remember every step forward matters. So please do stay committed to your Prime Health journey. And again, Dr. Jade, thank you so much for being an amazing guest here on the Prime Health podcast.
Thank you for having me.